Looking then at our different cell lineages, we start with our myeloblast, we move to a promyelocyte, and then we end up with a myelocyte prior to becoming a metamyelocyte. So myeloblast, promyelocyte, myelocyte, metamyelocyte, and then the adult cell, well, a stab cell, and then an adult cell. So when we look at our granulocyte development, there's 6 stages of development that we just saw in pictures. We start with a myeloblast. We have no granules really in the cytoplasm and a red nucleus. We then get distinct granules when we become a promyelocyte. We then become a myelocyte where our granules are different enough that we can differentiate between neutrophil, eosinophil, and basophil. And at this point, we still can undergo cell division. Then once we become a metamyelocyte, there's no more cell division and we have a slightly indented nucleus. And then we move to a band cell. This is where we have indentation that's greater than half the width of the hypothetical round nucleus, and then a segmented cell, which is more of the adult form. So this is showing a myeloblast. We can see this myeloblast here. This is not observed in a normal blood smear. We then have our promyelocyte, our myelocyte, and our metamyelocyte. Again, not observed in a normal blood smear. And then we end up with our band. The nucleus, again, is this indentated nucleus at this point. And our final adult form, our neutrophil or segmented neutrophil. These stains are using right stain, where acidic cells with acidic structures will take up the basic dye and look more blue, and cells with basic groups will bind up the acidic dye and appear various shades of red or pink or even orange. This is a normal blood smear. You can only see 3 white blood cells here, and these are all granulocytes. And being able to identify these different cell types is helpful for your lab diagnosis and for microscopy. Next, we'll look at how our white blood cells respond to infection. So, increased number of white blood cells are released from the bone marrow pool, and that leads to increased production from the myelocyte stage in bone marrow via cell division. Immature forms are released from the bone marrow, and the most common are band cells, and that leads to what's called a left shift because we're moving from our mature cell left down that developmental pathway. Severe infections could even see a further left shift, like an occasional metamyelocyte. Our 3 pools that we pull from for our granulocytes are the bone marrow pool, the circulating granulocyte pool, and the marginal granulocyte pool. In our early infection days, our circulating granulocyte pool, we'll see those cells marginate, roll along the endothelial lining of our blood vessels. And this starts happening near infected tissues. They then undergo extravasation using the process of diapedesis, where they move through the 2 cells, neighboring cells, and that's towards the site of infection. And then they will move quickly following chemokines to tissues. And it can then look like in the blood, we have a lower white blood cell count because all of our cells are moving out of the blood into the tissue towards infection. Our bone marrow pool will hold about a 4 to 10 day supply of immature cells that are released as needed as they mature, but then immature forms can sometimes be seen in circulation, and that indicates some sort of dysregulation in the release mechanism, or we just need more of them, so increased demand. Because bone marrow will respond to demand for increased white blood cells. When we have increased bone marrow output, the total body granulocyte pool will increase. But because things keep undergoing margination, our white blood cell count might still look normal or even decreased, which it would be considered masked neutrophilia. And later, our 2 kind of pools will equilibrate due to increased marrow output. And this is when we finally see our white blood cell count increasing and that left shift appearing. That indicates our body is responding normally. That's a normal response to infection. Then when we recover, the marrow output should drop, our white blood cell count should decrease, and the left shift should go away, and our white blood cell count should return back to normal. That's the end of this lecture. This should set you up well for our in-class activity where we are going to take a case and work through some of these different new lab components that we've learned from a CBC and a white blood cell count with differential.